All right, good morning, everybody. Thank you for joining us for this press briefing with regard to the state's response to the pandemic. As always, I want to remind people about the rules that we have and the tools we've given everybody to slow the spread of the virus. We have community spread out there, so we need everybody pitching in to be able to slow down the spread of the virus. That means to make sure you keep that 6 foot of distance between you and other people when you're in public, that you wear a mask when you go to the store, wash your hands often. That actually kills the virus for 20, remember, wash it for 20 seconds at a time. That kills the virus. That we want you to go to the store once a week by yourself. Don't take the whole kids going to the store. Also important as you're doing your holiday shopping to remember that it's better if you do it individually and not take the whole family to go holiday shopping. That's another way to slow it down. Work from home if you can. And of course, one of the key things is if you're sick, stay home. I know many Nebraskans, especially this time of year, try to just soldier on through a cough or a cold. This year, it's really important you do not do that, that you stay home. If you have any of those symptoms, if you're not feeling well, stay home. Of course, please take advantage of Test Nebraska. If you do have those symptoms, you can find out whether or not you specifically do have the coronavirus. But it's really important that if you have any of those symptoms, please stay home. And everybody in your household should stay home too until you get tested to confirm whether or not you have it. So please, please, please follow those rules. That will help us slow the spread of the virus here in our state. Obviously, we also want you to continue to avoid the 3 C's, which are those crowded places, close contacts, confined spaces. This is a virus. It spreads from one person to another. So if you avoid those places, you will help slow down the spread of the virus. And of course, wearing a mask when you can't avoid them will also help slow down the spread of the virus. So those are all important rules we want everybody to continue to remember. And also, you can take advantage of testnebraska.com to go get tested. We have delivered 479,000 test results from Test Nebraska. We have increased our testing our scheduling capacity. Actually, at the Oakview Mall, it's gone from 1,200 tests a day to 1,400. So more availability there in Omaha, and also we've taken Lincoln up from 800 to 900. So at Gateway, they do have a new location at Gateway to accommodate the new pods that we've got in place to accommodate the colder weather. So please, if you're going to go to the Lincoln location, understand there's going to be a new, it's not going to be in the parking garage like it was before. There's a new location. But again, we're taking capacity up there as well. So please take advantage of testnebraska.com. And of course, right now our hospital capacity is at 28% of hospital beds, 24% of ICU beds, and 66% of ventilators are available. And of course, we've got our chart here showing that we're at 869 hospitalizations for coronavirus. Compare that to October 1st, we were at 227, so not quite 4 times what we were then. And of course, we've created our program here with regard to the different phases. We're in orange phase right now. If we were to go to 25% of our hospital beds being taken up with those coronavirus patients, we would move into our red phase, which would have additional restrictions. And those would include the 10-person rule on inside gatherings and wedding receptions and funerals, 25-person limitation on outdoor gatherings. Bars would go to takeout, delivery, and carry out only. They would not allow people inside their bars, and restaurants would have restricted hours. So Nebraskans need to know that if we see an increasing in hospitalizations and we hit that threshold, there could be additional restrictions, those red restrictions. So everybody should be thoughtful about that and be making plans accordingly. Now, if we do go down, and we have seen over the last, you can look at the chart, you've seen over the last 10 days or so, we've seen a decline with regard to our hospitalizations. If we see that decline continue and we get down to that orange level, it would be a 7-day rolling average below the orange level for us to make the change, then to go down into the yellow level. And that would be lighter restrictions. So, but again, I want everybody to remember that all Nebraskans have the opportunity to be able to slow the spread of the virus and prevent those hospitalizations by using the tools we've given you and following the rules that we have in place. All right. So, also wanted to update everybody on contact tracing. You may recall that because we didn't ramp up our contact tracers at the state level fast enough, we allowed a backlog to be able to develop. We have pretty much addressed that backlog that we had of those days, and now we're really, the folks that maybe are not getting called on the day their test result comes in are the ones that come in later in the day. We are getting to those folks, though, the majority of those calls on the day they come in, and we are resuming calling those close contacts. You may recall that one of the things we said we were going to do is ask people to call their close contacts. Last week, we actually started calling those close contacts, and so we are doing that again at the state right now. So we've caught up on that backlog we had, and we're calling close contacts again. Next. Okay, so I've got Angie Ling, who is with as our incident commander for the Department of Health and Human Services, here to talk about our vaccine program. As you all know, we saw that Pfizer had submitted to the FDA their data with regard to their vaccine, and Moderna also now has submitted their data to the FDA. The FDA is meeting December 10th, and if they approve the Pfizer vaccine, we could see those vaccines actually arrive in Nebraska the week of December 14th. And our first shipment is slated to be 15,600. So that's very good news. And then we would expect to see continued shipments from Pfizer as well as they continue to ramp up production. Moderna, if they were to be able to approve, I believe the FDA is meeting again on December 17th, if they were to be able to be approved, then we could see the Moderna vaccine start coming to the state the week of December 21st. So this is all good news for the state of Nebraska. We did publish our plan out there with regard to the vaccine program. The priority is going to be people in our healthcare workers in hospitals, long-term care facilities, and so forth. And Angie Ling is going to give us an overall update on where we are with regard to that vaccination plan. So Angie, could you come up, please, and give us a few more details about what we've got going on here? And I think you've got an exciting announcement to make too, so.
All right, good morning. Thank you, Governor, for allowing me to share some information regarding the COVID-19 vaccination planning. As case counts rise across the United States, implementation of a successful COVID-19 vaccination program has become even more crucial. The overall effort of the Nebraska immunization program is to protect Nebraskans from diseases that can be prevented through vaccination. This program is mobilizing to reduce the impact of the COVID-19 pandemic and help restore some normalcy to our lives in our state. The Nebraska immunization program is focusing on COVID-19 vaccine planning, distribution, and administration. The program is conducting planning and coordination meetings that tackle the entire process. This planning includes diverse and varied competencies that include informatics, emergency response, epidemiology, communications, and the Office of Health Disparities and Health Equity. In addition, this program continues to work closely with external representatives from local health departments, the Nebraska Hospital Association, federally qualified health centers, community-based clinics, and health disparity tribal communities, as well as the CDC and Operation Warp Speed and the United States Department of Health and Human Services in an effort to infuse and utilize expert vaccine distribution and administration strategies in our Nebraska COVID-19 vaccine plan. The immunization program is aware that both Pfizer and Moderna have submitted data for an emergency use authorization from the FDA. If approved, COVID-19 vaccines will be allocated to states pro rata by population with a limited amount of doses being available initially. I'd like to run through what our forecasted allocations are. Please remember that these are forecasted, these are not definite numbers, and they can change at a moment's notice. For the week of the December 13th through 19th, we are anticipating the Pfizer vaccine of 15,600. The week of December 20th through 26th, we are anticipating Pfizer vaccine 19,500 and Moderna 32,100. The week of December 27th through 31st, Pfizer vaccine 23,400 and Moderna 14,200. With a total being just over, with both vaccinations, over 100,000 for the state of Nebraska. Due to the limited COVID-19 vaccine, immunizations programs have been encouraged to utilize a phased approach to the vaccine allocation. It's vitally important that those on the front lines in the fight against the pandemic stay as healthy as possible and that we reduce their chances of spreading the virus. This is why the first allocations will focus on healthcare personnel. such as providers, nurses, ancillary staff in direct contact, home healthcare, pharmacies, EMS, which is a new addition to Phase 1A, and other healthcare staff with direct exposure to patients or infectious materials. Subsequent phases can be found in the Nebraska COVID-19 vaccination plan and are subject to further clarification and prioritization by the Advisory Committee of Immunization Practices, which is ACIP. As COVID-19 vaccine supply increases, more Nebraskans will receive the vaccine. Another critical component that we have been working on is the proper infrastructure for data transmission. Our program focus is on COVID-19 product logistics with manufacturers and commercial partners that are part of the CDC's centralized COVID-19 vaccine delivery system. The Nebraska State Immunization Information System is equipped to receive vaccine administration data and is prepared to transmit de-identified vaccine data to the CDC. Other areas of program focus is communicating vaccine safety, tools to addressing hesitancy, and shared updated training materials provided by CDC and vaccine manufacturers. These tools can be found at the immunization program's webpage, which is dhhs.ne.gov/pages/immunization. I'd like to take a moment to recognize the small but mighty teams that make up the immunization program: epidemiology, informatics, communications, and all of the COVID-19 vaccine planning group participants. I would like to echo the importance of avoiding the 3 C's: crowded spaces, close contacts, and confined spaces. Remember to maintain 6 feet of distance when you're with people outside of your household, and be big red responsible by wearing that mask. If you haven't received your flu vaccination yet, please get yourself and your loved ones vaccinated. Thanks.
Thank you very much, Angie. So a couple of things just to build upon what Angie said there. The new addition of having the EMS folks in the Phase 1A is a request that the folks in, the EMS folks across the state have been making, and makes a lot of sense. Again, we're really targeting people who have that direct interface with people who may be coronavirus positive. So that's a change to the original plan that we had put out there. And also that per capita distribution that we are getting from the federal government is based on people who are 18 years or older. So it's not just a census number from the whole population. It's only people who are 18 years or older, and that's because the vaccine is not originally, at least being distributed to children. So they're looking at only people 18 or older for that whole vaccine plan. So just a couple of things on there that we're finding out as we get closer to having potentially the vaccines here. So we're hoping that the FDA approves those emergency use authorizations, and we get the opportunity to start distributing those vaccines to our healthcare workers starting that middle of December. So exciting news there. So great stuff. All right, next. Before we get on to questions here and the rest of the schedule, I did want to take a moment to address a news item that came out yesterday with regard to the ACLU lawsuit against the state of Nebraska. Our Attorney General did a great job of defending the state of Nebraska, and he is going to have a press conference on Friday to go through this in detail. Our Corrections Director, Scott Frakes, has done a great job across his entire career here at Nebraska, working together with his team, who've also done great work, to improving the things we need to improve upon within our correction system. The World Herald headline is wrong. It is absolutely false. It is not true. This was not a negotiated settlement. The Attorney General beat the ACLU and beat them badly. The headline's crap, and frankly, as our flagship paper, the people of Nebraska deserve better. This was not a negotiated settlement. This was a win for the state of Nebraska. So, wanted to clear that up. Our upcoming schedule is going to be December 4th, 10 a.m. Next week, we're going to be Monday, Wednesday, Friday at 10 a.m. as well. I also have my radio call-in show on KFOR at 2 p.m. So, regular schedule for December 7th on that. Questions? The daily online reporting of Nebraska cases has been delayed quite a bit over the last few weeks. They were supposed to come out around 6 o'clock. We've seen them well past 10 o'clock. That's coming from Kevin Westhughes at WWT. And Kevin, I agree with you 100%. We are working to get that. Part of it has to do with the amount of data that we're processing and getting that whole thing out to make sure we got accurate data. But I agree with you 100%. We've got to do a better job of getting that out in a more timely manner, and we are working on it. Michael Shively from News Channel Nebraska. What led to changing your position on withholding CARES Act funds from counties with courthouse mask mandate, and when did you make that decision? Actually, we did not change our position on that. So when I came out and said that counties who withhold state services from people would not be eligible for CARES Act, that was with regard to the presumed payroll, and we made a decision afterwards to cover that presumed payroll after I made that announcement for just through the end of May. So that's wasn't a change of policy, it's just the timing of it was such that we made the decision after how much we were going to cover for afterwards. So if there's additional, what I would say though is if there's additional stimulus money coming, we would take that into consideration if any citizen of Nebraska was denied state services because of a county's decision on a mask mandate. All right, Becca Costello, NET. An NPR investigation found 2 members of Co-Diagnostics boards were sold nearly $1 million worth of company stock in May after another private company involved in Test Nebraska pitched it as a volunteer effort that no company would make any money off of it. The investigation also found those board members did not publicly disclose some of those stock sales before a legal deadline. Do you believe Co-Diagnostics and other Test Nebraska companies are able to provide testing with most efficient use possible of taxpayer money? And the answer to that is yes. I believe that they're doing a great job of providing those Test Nebraska. You know, again, this is a free service to the people of Nebraska. It's allowed us to expand testing greatly here in our state. And I don't actually recall that, certainly when we, the state, were making the decision about bringing them on board, being a volunteer effort was not part of our calculus in this. It was about were they going to be able to deliver the testing to the citizens of Nebraska. And while we've certainly worked through some of the startup issues that we've had that you would have in any startup operation, Test Nebraska is doing a wonderful job of providing that additional testing. So with that, I will go ahead and, Taylor, do we have anything else that was sent in?
Don Walton asks, could you clarify your current position on whether you would withhold CARES Act funding from counties that require masks in county courthouses and why you may have changed your position?
So Don Walton is also asking, very similar to Michael Shively, with regard to, can I clarify my position on counties? Again, the money that's coming on the presumed payroll was for the end of May. If there's more stimulus money coming forward, we will certainly take that in consideration. But if any citizen gets denied services because of a county mask mandate, yeah, that could be something that for future CARES Act money could create a problem.
And then he also asked, with additional CARES Act funding blocked in Congress by the partisan divide, should the state consider targeting some of its anticipated surplus revenue to individual or business economic assistance?
So Don's asking with the federal stimulus being blocked in Congress right now, would the state consider additional relief going forward? And certainly that's something that we will take into consideration. I'm hopeful that the Congress will work together to be able to come to some sort of agreement. But you know, certainly we, the state, will take a look at what additional resources we may need to be able to provide to folks as we work our way through this pandemic.
Jeff Robb with the World Herald says, as the population of people who get the vaccine expands, how will people find out they are eligible?
So Jeff Robb at the Omaha World Herald says that as the population expands, how will people find out about that? I think, for example, one of the things that we can do at the state is be able to have those public service announcements with regard to who's eligible. But folks, I do want to caution that it's still going to be a very limited distribution here at the beginning of it. That we're not expecting this to become available to the general public till probably April. Now, hopefully it comes sooner than that, but initially it really is going to be targeted at these populations like we've talked about with healthcare workers and long-term care workers, EMS, and then following that would be long-term care residents. So this is not going to be distributed to the general public, not likely at least until April, which is why, again, we need to continue to follow all of our rules with regard to avoiding the 3 C's and washing your hands and wearing a mask and staying home when you're sick.
Jeff Robb also asked, how long will it take to vaccinate the phase 1A groups, and when do we expect to move to the further phases?
Jeff is asking how long will it take to inoculate the phase 1A group, and then will we move to additional phases? Well, again, the additional phases will come as we have more vaccine to be able to distribute. And again, one of the other things I wanted to point out is, remember, this is a 2-dose vaccine, at least for both Pfizer and Moderna. So you'll get the first inoculation, and then 2 to 4 weeks later, you'll get the second inoculation. And the federal government will be withholding that second inoculation until you get the first inoculation. So it will be something that we have to make sure we follow up with everybody who gets that first inoculation to get the second inoculation to get that complete protection. With regard to how long will it take to roll that out, we're going to work with our hospitals. For example, they're going to need to think about how they phase this in, because there may be some side effects like sore arms and things like that. So they have to be thoughtful about it. They can't just give it to everybody at once. They have to be thoughtful about how they phase this in. And so that will take some time to be able to distribute that. But again, folks, I really want to caution everybody to remember the numbers we're talking about are just forecasts. They haven't been delivered yet. And in fact, these haven't even received FDA approval yet. So we have to go through a couple of steps here. And then even if this follows according to the plan that's been laid out, we're not likely to have general population until April. All right, great, thanks. Questions? Yeah.
Governor, I want to clarify the courthouse mask mandate details. The statement that your office confirmed yesterday said the no mandate requirement covered the reimbursement period ending May 31st. Counties that impose mandates after that time will not have CARES Act resources withheld, but you just said they might. So
if there's future stimulus packages coming down the road and a citizen gets denied services, that could impact the county's ability to get it.
Has it always been a May 31st deadline, the entire thought process?
No, the question with regard to May 31st, that was a decision we made as we were evaluating the requests that were coming in from the counties, and certainly additional guidance from the Treasury. They had made, put out a number of different, the Treasury put out a number of different documents of what could be covered and what would not be covered. And with regard to the presumed payroll, that was something that, again, was an evolving issue. So we made that decision, I think it was sometime in July with regard to the May 31st numbers and the presumed payroll.
When we asked you on November 10th and 12th, you said you weren't sure. So July is when you were sure?
I believe that's when we made that decision with regard to the presumed payroll.
Did you then notify all of the counties in Nebraska that they would not be withheld their CARES Act funds if they had mask mandates?
The question was, did we notify all the counties with regard to the May 3rd, in July when we made the decision with regard to the May 31st deadline? We did not notify them that that money would not be withheld if they did a mask mandate afterwards.
Why did you not notify them that they didn't do that?
Why did we not notify them? Because again, my policy still is don't deny any citizens of Nebraska services. With regard to it, with regard to our state services, we wanted counties to continue to make sure they're providing our services. Martha.
On the vaccine, how soon before the first people might actually get a vaccine, and how soon before you'll have needles going in arms, and when would the first people be then immune?
So the question was, when will first people start getting inoculations, and when will people potentially start being immune? If this follows the plan where the FDA does approve the emergency use authorization for Pfizer, and we receive that first shipment of 15,600 the week of December 14th, potentially you could see that week then people getting that inoculation. So the shipments will be shipped directly to healthcare providers like the hospitals, and that hospital then, once they receive it, could start theoretically distributing it that day. The kits will come with needles. In fact, Becking Dickinson, one of our companies that's got several facilities here in Nebraska, is making some of those needles that will come along with the vaccines and everything. So anyway, so they could potentially start doing those vaccines that week. Now, when would those people get immunity? Well, you won't get full immunity until after you've received the second dose. There has been some speculation, Dr. Birx, for example, said this on one of our White House calls, that you may receive some level of immunity after the first one, but to get the full protection, that full 94, 95% protection, you will have to get the second round of that immunization to be able to get that full effect. And then Dr. Antone, after you get that second round, do you have an idea on how long that would take to take effect?
I think that's why we have to wait for the FDA data. They're analyzing all that data right now, and that's what the committee will do on December 7th is outline that data.
Yeah, so Dr. Antone's response is that we will have to wait and see what the FDA data says. They're going through that data right now, and so they've got submitted that to the FDA. The FDA will probably have an idea once they've analyzed that data how long it will take for you actually to receive that immunity.
And it's public, so we should know right away.
And it's public, so we should know right away. Yeah, Andrew.
Are we covered across the entire state for everybody, from border to border, that there'll be access to this vaccine right away?
So the question was, are we going to be covered border to border with regard to the vaccine? And so that's part of what our plan is, working with the Department of Health and Human Services and all of our providers, is to distribute that, and then working with the hospitals on their distribution plan as far as how they get that out as well. So we are working, to cover the entire state. Again, it's going to be the kind of thing where we're phasing in around healthcare workers. So again, I want to caution everybody, it's going to be around healthcare workers. But that's what we're working toward, yes.
And the other question is, how many people are in that group 1A?
So with regard to that group 1A, we believe there's roughly 90,000 people. So again, if you think about those people who are going to be facing coronavirus-facing providers or EMS folks or whomever, that's about 90,000 people. So that will basically use that first group of the vaccines that we will get in December.
We have a couple more questions. Jared with 1011 says, are you concerned at all with where hospital capacity is at? Although numbers are slowly going down, it's likely due to elective surgeries not going on in Nebraska's hospitals.
So Jared was talking about my concern about hospital capacity. Again, we monitor hospital capacity as really our guidepost for how we're making these decisions. And while hospitalizations are going down, he said, is that because of elective surgeries? These are specifically coronavirus patients. So while there certainly could be some people who are coming in for elective surgery that did test positive for coronavirus as part of this number, what we're focused on is not only the overall hospital capacity right now, but where we set these different levels for phases is on coronavirus patients specifically. And so we want to continue to make sure, even though the trend has been down for the last 10 days, 2 weeks or so, we got to make sure that we continue to stay vigilant with regard to following our rules, using the tools to slow down the spread of the virus so that we don't see that number come back up again.
And then Jeff Robb has a couple more questions. Which hospitals are getting the state's first doses, and how are the initial December doses allotted among the top priority categories of the preparedness?
So we have to Jeff Robb is asking which hospitals are getting the first doses. We have to turn that plan into the federal government on Friday to lock that in. And so when we get that all put together on Friday, we can make an announcement with regard to that. Yeah, Andrew.
Governor, if I've already had the COVID-19, do I still have to get a shot?
So the question was, if I've already had coronavirus, do I have to get the vaccination? Well, first of all, we're not going to require anybody to get the vaccination. That will be up to the person to decide whether or not they want to get it. Again, the data with regard to how long your immune system may continue to produce antibodies once you've had the coronavirus is still a matter of research. So if you wanted to be on the safe side, yes, you would want to get that vaccination, even if you have had coronavirus. Martha.
You said the group is roughly 90,000 people in the 1A, but if we're getting 100,000 shots, doesn't that only cover 50,000 people because they have to get the second shot?
So my understanding is that that first round of coming in the month of December is with regard to that first round, that the federal government was withholding the second round. And remember, you have to take that 2 to 4 weeks later anyway. So even if you got, say, a shot on that second week of December, you're not likely to get your second one until January anyway. So these are just the shipments that are coming in for November, or for December rather.
Is there some mechanism to guarantee that that second shot will be available so that people can get the 2 shots and that we won't end up running out, giving everybody these first shots?
Right, so the question was, is there a mechanism to guarantee that the second round will be available when you're due? And that, of course, is part of what the whole federal government's operation is to continue to ramp up the number of dosages of these vaccines. So I know that Pfizer just broadly was planning on having 20-odd million in December and 25 million in production in January and 30 million in February. So they are planning on ramping up their production, and it'll be up to the federal government then to distribute that out to our providers to be able to provide that second round. Yeah, Andrew.
For either you or Dr. Antone, I mean, emotionally and maybe mentally, how important is this announcement?
So the question is, how important is this announcement? I think it's important. It's really to allow people to know that help is on the way. There's hope out there. We still have months ahead of us going through the winter to practice all the things we know about how to slow the spread of the virus, from keeping that 6 foot of distance to washing our hands, wearing a mask when you go to the store. All those sort of things are going to still be important as we go through this winter. But the help is on the way, and that we have that vaccine. We just have to continue to be diligent as we go through these next several months, and then we'll be able to start getting the vaccine distributed more broadly, and that will allow us to ultimately really, take down this virus. Yeah, Martha.
What, are there some communications that are going out now to convince people to actually take this vaccine? I mean, there have been some surveys that suggest even among healthcare providers, there's reluctance.
So the question was, is there going to be a communications campaign with regard to helping people be comfortable with taking the vaccine, and it could, because maybe even some healthcare workers are reluctant? And the answer is yes. I mean, part of what we are going to be doing, and the states and the federal government can be talking about how this goes through the process. Obviously, first of all, it has to get approved by the FDA, right? So that's our first step. But once that happens, and as Dr. Anton points out, we have a chance to take a look at the data, we'll be able to tell you exactly what that data says with regard to the efficacy and so forth. Again, literally tens of thousands of people have participated in these vaccine trials. That is much, much larger than what would normally be done for this kind of drug or vaccine. And that is what is allowing the FDA to really collect a lot of this data very quickly to be able to make a decision. And so that's one of the things that people can feel comfortable about. There's a lot of data being collected with regard to these trials. And obviously, again, we have to wait and see what the result of the FDA analysis is. But if that goes forward, then we can start talking about the efficacy and so forth, and how, and all the safety and side effects and things like that. Because as Dr. Antone pointed out, that'll be public data. Yeah, Andrew.
How far are you down the list, and will you want to get the shot?
First of all, so Andrew asked, how far am I down the list and will I want to get the shot? Again, assuming the FDA approves it, I will have no qualms about taking the vaccine. I am not on that priority list, though. That is, again, for our healthcare workers. And in fact, I don't even think they created a separate category for governor on that one. I think I fall into that general population that would be eligible to start getting it, sometime in the spring.
We have another question from Jeff Ross.
Yeah.
Will Nebraska be able to move to phase 1B by January?
So the question was, will Nebraska be able to move to phase 1B by January? And that is really, obviously, we would like to be able to move forward to phase B as quickly as possible. It really will depend upon, again, the FDA approving Pfizer and Moderna, how many of these vaccines we actually receive, and then, of course, making sure that we get the phase 1A people taken care of first.
And do you know how many people are in the phase 1B?
And the question is, do we know how many people are in phase 1B? And I do not know off the top of my head. We don't have that data right now.
And is the next group, is that the general public after phase 1B?
And then the question is, what's the group after phase 1B? Do you want to just come up and talk about a little bit of that, Angie or Dr. Antone? Jerry? Jerry, you want to come up and talk about that? We thought you were going to get all the way through this without saying anything.
I was really open. Could you give me the question one more time?
I guess, do you know how many people are on phase 1B, and then who's after phase 1B? When does the general public?
So you're asking the population for phase 1B. While I don't have those numbers in front of me, I do have those populations enumerated back at our office. So we could, we could get that and follow up with you. And was there another part of your question?
What's after phase 1B?
After phase 1B would be phase 2, and that is the general population. That's where we can really open things up.
And will it be divided on age? Will you want a certain age group that you want inoculated first, or will it just be open to anybody?
For all phases, we would follow the ACIP recommendations to execute those vaccines. So if it gives us an age bracket, that's where we'll stay.
Thank you, Jerry. Martha.
Do we have any idea how long these vaccinations will protect people?
So the question was, do we have any idea how long these vaccinations will protect people? And again, I think that that's part of what we have to wait and see as the FDA evaluates the data, whether or not that's part of what they know. So I guess we just have to wait and see what the FDA comes back with.
And for the initial shipments, it sounds like we got plenty of cold storage, ultra-cold storage, but is that ultra-cold storage spread out across the state, or is it concentrated in just certain areas?
So the question is, where is that ultra-cold storage? And it is, again, that kind of storage is limited with regard to how many facilities have that across the state. But we will work with different communities, and remember, if we get Moderna approved a week later, that one doesn't require the ultra-cold storage, and so we'll have more flexibility about how we distribute that. We won't have to have that ultra-cold storage to ship to those hospitals. So that's part of our overall plan for how we get the vaccine distributed all across the state. All right, I don't see any other questions. Again, folks, I want to remind everybody that please, even with the great news we have about the vaccines that are going to be coming to the state this month, assuming the FDA approves them, that we're going to be focusing on those healthcare providers and, again, people who are going to be interfacing with people who are coronavirus positive, okay, those patients. That'll be the first group. That means that throughout this month and through the winter, we're going to need to continue to remember all the things we need to do about watching our distance, keeping that 6 foot between you and other people, washing your hands often for 20 seconds at a time, wearing your mask when you go to the store, staying home when you're sick. That's an important rule. Making sure that you're not infecting other people by going out when you're sick. Work from home if you can. Go to the store once a week by yourself. Avoid the 3 C's. These are all things we can do to be able to help slow the spread of the virus and ultimately make sure we protect our hospital capacity so that anybody who needs that acute care can get it when they need it. That's the whole goal of trying to slow this down, is to make sure we can preserve our hospital system to provide that acute care. So please, everybody, pitch in to be able to help slow down the spread of the virus. Help us on the way, but we need to continue to make sure we're not letting our guard down here over the next several months. Thanks again, and we'll be back again on Friday at 10 a.m. Sure, one more, Andrew.
If all goes the way you hope it goes, when will we be back to normal?
So Andrew's question is, if all goes the way we hope, when will we be back to normal? And, we want to get back to normal as quickly as possible. A lot will depend upon how many other vaccines come down the road and what the production of that is. So if we start seeing general population taking the vaccines maybe in April, and it takes several months there, I could imagine that we could, maybe have enough people vaccinated by sometime in the summer. So, but again, a lot has got to happen, and we got a lot of work to do between now and then to be able to get there. So thanks very much, folks. Appreciate it. Have a good one. Thank you, Francis.